We had a tragic incident in one of our inpatient units. It involved a night nurse, and one night during her shift, she reached a final crisis point. Her coworkers were unaware of just how bad things had gotten for her, but they noticed that something just didn't seem right, so they encouraged her to take some time alone, somewhere, having a moment of peace and quiet to gather herself, which she did. And shortly after, the unit's charge nurse found her in a supply storage area, having died by suicide. It was a shocking and traumatic event for all of us. Following the incident, we did everything we could to support the team, who was not only managing the loss of a coworker and friend, but also the pain of wondering what they could have done differently to prevent it. In fact, the CDC has identified that healthcare workers of all kinds work long hours and under difficult conditions, exposed to infectious diseases, and even violence from the very people they're helping. They're regularly exposed to real tragedy, suffering, and death. We work in a field that often centers around the most traumatic, painful, and frightening aspects of life. The very nature of what we deal with is life and death, and I think dealing with it has simply been a part of the job. It was expected, but we know better today. The American Hospital Association's Health, Research, and Educational Trust released a new guide that offers 12 evidence-based interventions for establishing or expanding a suicide prevention program. They're focused on reducing the stigma, improving access to care, and removing job stressors. A fundamental part of our culture at St. Luke's is that we believe it's just as much our responsibility to care for one another as it is to care for our patients. We provide an employee assistance program, but we go well beyond that. We provide education and support through webinars, on-site and virtual well-being check-ins, and consultations for our highest risk groups, nurses and physicians. Even before COVID-19, careers in healthcare were among the most challenging and stressful. These risk factors have never been easy to deal with on any level, but during the COVID pandemic, they were all significantly magnified, and there's no sign that this set of challenges will end.